I'd like to call the meeting of the June 10th, 2021 Durham County Board of Health to order. And let's jump right into the agenda. Welcome everybody. Before we do that, hope everybody's had a great little month off from Board of Health meetings. We'll jump right back into everything. We're going to start with a discussion and approval of any adjustments needed to today's agenda. Any adjustments needed to the agenda?
Mr. Chair, it's Rod Jenkins. Great
Yes,
to hear
sir.
your voice. I do have an adjustment. If I may, with your permission, we have fiscal year 2021-22 fee schedule update. That needs to go under old business, and it will require a board approval.
Thank you, sir. Not a problem. We'll put that as the third bullet on the old business.
Yes, sir.
Thank you. Anyone else? Like to hear a motion to approve the agenda with the one adjustment to the agenda?
So moved. Spence Curtis.
Is there a second?
Seconded, Dr. Ray.
Thank you, sir. It's been moved and seconded to approve adjustments to today's agenda. Can I get a roll call vote, please?
Chairman Island,
Yes.
Dr. Jackson,
Here.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto, Mr. Brown,
Yeah.
Commissioner Alam, Dr. Ray,
Yes.
and Dr. Miller. Dr. Miller is on. He is actually giving blood. So I'm going to accept his yay. I see him here. And he did call earlier just to say that he may have to get somebody to unmute his
Yeah. Can you hear
Dr.
me?
Miller? Okay, thank you.
Yes, I'm here.
Thank you.
Very good. The agenda has been approved, is adjusted. Item 3, review of minutes from our previous meeting on April 8th, 2021. Any adjustments or corrections to those minutes? Hearing none, I'll entertain a motion to approve.
Spence Curtis, so moved.
Second.
Thank you. It's been moved and approved. We have a motion to approve the minutes with a second. Can I get a roll call vote, please?
Chairman Island,
Yes.
Dr. Jackson, Dr. Jackson, Rosemary,
I'm sorry, I was talking, I was on mute. Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto, Mr. Brown,
Yes.
Commissioner Alam, Dr. Ray,
Yes.
and Dr. Miller.
Yes.
The minutes from our prior meeting on April 8th have been approved. We move to item 4 on the agenda. Do we have anyone signed up for public comments?
No, sir.
Thank you. Having none, we'll move on to item 5, staff and program recognition. Mr. Jenkins.
Thank you, Mr. Chair. They are not staff, but they, by virtue of their position, are a part of us. I'd like to first recognize Dr. Rosemary Jackson for all that she's been doing with COVID vaccinations. She joined us at Mount Calvary Baptist Church in Bahama a few weeks ago, and I'm pretty sure we may be together on tomorrow for our second dose screens. But it was a pleasure to be with you, Madam Vice Chair. And I do know that you've been doing a lot with the Old North State Medical Society as far as COVID testing and COVID vaccination. So I just want to recognize you for all the hard work that you've been doing.
Well, I appreciate that. Thank you. No, it's been my pleasure. But I haven't been doing nearly as much as our Dr. Mary Braithwaite. So I'm sure you're about to recognize her. She has been doing it. And unfortunately, I won't be with you tomorrow. I'm in Florida.
Oh, man. It's all right. Well, I definitely wanted to recognize Dr. Mary Braithwaite. She has been on a tear in partnership with Durham Public Health, War for Life. Of course, she is Chapel Hill Pediatrics and Durham Public Schools. And she has been there rolling up her sleeves, doing a little bit of everything. I think I've seen a little bit of pre-filling. I saw a little bit of shots in arms. I saw some straightening up the lines. So I was quietly observing you be the force that you are. On behalf of Public Health, we just want to say thank you for really, really not just standing on the sidelines and doing your vaccinations, in your area of expertise, but you've actually been in the community, and that's what public health is all about. We thoroughly enjoyed collaborating with you. I know, I definitely want to pass to my deputy, Liz Stevens, to see whether or not she has any kind words she'd like to share with you as well.
Yes, thank you, Rod, and Dr. Braithwaite. It's been a total pleasure to work with you. We've really gotten quite a bit done in partnership with all of the great community organizations that we've been working with. And I think from right off the bat, we have been very thankful for you to jump in and help us get vaccines out there at that fateful point where the state said, empty your shelves. I appreciate you answering that call, and we've just been running from there. So big thanks to you, of course, to my co-deputy, Kristen, who has been doing much of the organizing around these events, but we are truly thankful.
Dr. Braithwaite.
I think you guys are awesome. I just enjoy working with you, and it's contagious. You guys infected me with the urge to get these vaccines out there. So I'm just grateful to be on your team. Thank you.
Cool beans. But to my two members of the board, we just thank you so much for all that you're doing. Dr. Jackson?
Yeah, I was going to say, while we're having this love fest, so I just have to give kudos also to your staff, Rod, because like you said, we were together at Mount Calvary, and they said they'd be there at 2. And I said, ooh, the other events I've done, folks started, 2 hours early, not coming till 2:10, y'all weren't there. So, oh my goodness. About 2:15, they showed up. They got that thing set up and going in 20 minutes. It was something to see. So kudos to y'all. Everybody was so professional, exactly knew what they were doing. Everybody had their role. It was great. It was great. Like I said, it was something to see. So kudos to the staff for their efficiency, their enthusiasm. Everyone stayed in a good mood. It was kind of a slow day a little bit, but everybody was upbeat, and it was great. So kudos. So I was glad to get a chance to see them in action like that. So please pass it on to them. Yes.
Thank you very much, Dr. Jackson. We'll be sure to pass on your kind words. We have an all-staff meeting on tomorrow from 9 to about 12. So that's a perfect opportunity to send your salutations. Mr. Chair, just got 2 more things I'd like to pass on, just really kind of letting you all know. We did receive an award, just got some hardware, just want to show you all. I got this symbol that Dr. Jackson is very familiar with. The Recovering Renewal Task Force did receive on May the 15th an award from the Durham Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And it's just basically yours truly accepted the award on behalf of public health and the Durham Recovery and Renewal Task Force. And it's just really talking about in recognition and appreciation for outstanding community service in relation to all that we've done for our COVID-19 surveillance and vaccinations. And then we also received from Alliance Health in May the Making a Difference Award. And this is in recognition of our dedicated in helping individuals, families, throughout the community, throughout COVID-19 events. And of course, we were in person. I passed this around. And then finally, we got a certificate of achievement from Meals on Wheels. And this was just in the month of March, just really, promoting our dedicated community service. So again, the hardware continues to come. I take no credit. It's all about the staff and all the hard work that they've been doing to get us to this point where we're in a much, much, much better place with the COVID surveillance and response. So, Mr. Chair, didn't mean to take too long, but just wanted to give credit where credit is due, and I will turn it back over to you, sir.
Well, thank you, Rod. We appreciate it. We thank you for your hard work through all of this. And most importantly, please thank the staff again on our behalf. Dr. Jackson, Dr. Braithwaite, amazing people as always. You do great work for the community. And just want to say thank you for all you do for Durham. All right, anyone else like to chime in real quick before we move on? All righty, we'll move on to item number 6 on the agenda, administrative reports and presentations. We're going to get an update on EPIC for fiscal year 21-22. Marcia Richardson.
Good afternoon to members of the board. I'm Marcia Richardson, IT Division Director, and I won't be before you long, but I did want to give you an update with our UNC EPIC implementation and just to give you a little bit of information about where we are today and our journey down this path. So to those of you who may be new to this implementation, we actually had an initial start of going live with EPIC for April the 28th in 2020. And so around that time is when COVID actually began, and we actually had to put a pause to our efforts with this implementation. We then felt like we were at a good place, and we had had conversations back and forth with UNC, and we had decided to reschedule for this implementation in October, and we had to put another pause on it. And then finally, we were able to get a set date for February the 23rd in 2021, and we were able to implement. So a little bit about the background. Initially, all of our departments were on different EMR systems. We had a dental department who was also utilizing an EMR system. We also partnered with Duke, and we had an EMR system that we were working with our OB, maternal health department. We also had our lab who was also using a separate EMR system. So our goal was to really engage and try to do interoperability framework in order to make sure that we would be able to have a great communication and a great referral throughout the entire department and utilize just one system for all of our service offerings. So the divisions that were a part of this EPIC implementation was our nutrition clinic, our communicable disease department, which includes all of our STI, TB, refugee health, all of those consistent of communicable disease. We also had our women's health, which is our family planning, as well as our maternal health, our dental clinic, our lab, and also our health education testing team. And of course, our population health was included in this at this time. During that implementation, we had a number of phases that we went through. We started off, and of course, during that discovery phase, it started well before our first go live date or trying to move forward with go live. My apologies, I have to let a few people in. Give me 1 second. Okay, we have a few more attendees joining us. So during our project phases, the discovery visits started well before our April 28th, 2020. We had a number of discovery visits where we talked about what this new EPIC system would look like, getting an understanding of our team's workflows, understanding our providers, understanding what entails about what we do at the public health department, and walking through a number of different scenarios for like day-to-day operations. We then were able, after they gathered all this information up, EPIC was able to start working and doing our build. And this is when, you know, there's still a number of dialogue, a number of meetings that go on every single week to really be able to engage our team members, and not just those who were doing the build, but be able to engage all of our team members, from our super users, our program managers, our users on front lines, as well as throughout the health department, being able to understand and engage them as well in the entire process. We also had a number of technical teams that actually were a part of this, where we really did a number of dress rehearsals. So as UNC was actually doing a number of build components, we were able to kind of see exactly what this configuration would be set up as, in terms of, you know, our interfaces, as well as, you know, being able to ask questions about how we do our referrals, and what it will look like in terms of being able to check someone in and things of that nature. So all of those were included in our technical dress rehearsal. And our readiness phase is when we actually scheduled meetings to really talk about, you know, what this workflow would look like, because again, you have that opportunity where people can actually talk about what their workflow looks like, but then also engaging with UNC to be able to ask questions and understand and practice in the system, to kind of talk about, you know, what the workflow would be like on day one. Our operational dress rehearsal, this is where we actually were able to talk with our end users, be able to understand all of the our frontline team members, and also be able to do like a dress rehearsal to understand and engage our super users with those within the department, to be able to do sort of like real life scenarios, so that on day one, when we have patients coming in, they know exactly how to move throughout the department, and be able to go and move in the system, from, you know, the cadence component where you're checking in a patient, and from our nursing team to be able to document in the correct areas, and then being able to have our billing engaged, so that they can actually be able to process that information that our clinicians actually did during the day. So some of those accomplishments that we actually were able to do, you know, we had a number of trainings. And when I say a number of trainings with EPIC, there are over at least 5 trainings per person. And our teams were really involved in, and for our go live, they actually asked that we come on site. So during this time of implementation, we had over 120 employees that were actually engaged in going on site for training during the social distancing, as well as keeping their mask on and being able to ask questions and being able to do hands-on training, was what made our EPIC implementation a success. We also had our bi-weekly meetings. We had weekly meetings as well. One of the greatest things that we actually did within our department was that we had individuals engaged in each and every single department within public health. And I did want to also give just a recognition to Patrice Carr, who has really, really been a great super user in helping us to align our department, being able to give us feedback, understanding, you know, what the needs were, if there was something that needed to be adjusted. She was really giving feedback. So I definitely wanted to give one of our team members a kudos for that. Our super users have been engaged in the beginning, and they engage each and every single one of our departments. We've received so much feedback from our clinicians, as well as our registration team members, just saying how much they really appreciate having Epic. We also have been in conversation and had a number of meetings, and still have meetings going on also with Duke as we continue down the transition with our maternal health and our OB clinics, just making sure that we can engage and get the information that is needed over to Duke, as well as having our residences use the UNC system. So that's really been a great partnership. So just a couple of key dates. We really had a timeline that kind of took a turn for twice, right? So we have these key dates, but as we had to get geared back up, you actually had to go back through and really get our teams back engaged and make sure that everyone understood that we had the trainings involved, and then also making sure that we had the builds involved. And so we actually had a great opportunity. I think COVID, as unfortunate as it was, it really did give us a time to be able to take a slow walk into this process, because every implementation within UNC, they give you typically 6 months for this implementation. And during this time, we actually really had an opportunity to really sit down, think through it, and be able to move forward at a pace that was really sustainable for our teams. On our go live day, we actually had 11 on-site elbow-to-elbow support team members, and they were able to stay on site for 3 weeks with us. They were in our departments with our team members every single day, being able to answer questions. We had daily stand-up calls, whereas the UNC team was actually on the call 24/7. So this call stayed open where our team members could jump on, ask questions, get any changes that needed to be made, and then get back and start operating efficiently. This was really helpful for our team members. They felt engaged. They felt like they had the support that they needed. And of course, being able to have that individual there, elbow support, along with our super users, really helped to make this very successful. We were also able to do some additional trainings, whereas like your telehealth visits, being able to understand how to do those telehealth visits, we were able to get some WebEx meetings and additional trainings for our team members as well along this way, since going live with on February the 23rd. So overall, I will say that our UNC Epic system has really been a successful implementation. Kudos to our director, Director Jenkins, as well as all of our public health team members, because they are who made it success, and we really appreciate everyone. And are there any questions?
Thank you, Marcia. We appreciate it.
Thank you.
Mr. Chair, if I may, I'd be remiss if I did not also echo some sentiments of gratefulness to the staff, particularly the leadership of Marcia Richardson and her team. As y'all know, going to any EHR and then implementing it during regular times is not easy. But to do it during a pandemic is like even more complicated. The staff did benefit from the fact that we had a reduced schedule, and we did have some time, particularly with the elbow-to-elbow support individuals, to really, dive into the layers of getting everything that they're supposed to get. Everyone went to the training that was held at UNC satellite site, present company included. So I mean, it was a huge feat. So I just want to say to the board how grateful I am to the staff. We are one of the very few health departments in the state of North Carolina that is on Epic. I do believe that there may be only 2 others, to include Orange County and Pitt County. So it's a huge accomplishment, and we are truly the envy of the other health departments, because to have that connectivity to a major hospital system is huge. So thank you for that, Mr. Chair.
Thank you, Rod. We appreciate your efforts. Appreciate you, Marcia, and your staff, and appreciate all our public health staff for the great work you've done through such trying times. Anybody
you.
else have anything to say? All righty, thanks once again, Marcia. Item 7, now's the opportunity to ask questions of staff with regard to the public health vacancy report. Any questions for staff regarding the vacancy report? All righty. How
Mr. Chair?
about yes, sir.
I wanted to follow up, if I may, on a request that Dr. Jackson had last meeting as it related to the number of nursing positions.
Yes,
since
sir.
Since the pandemic began, just some information for the board. It was a tad bit sobering to get the data. I do believe that when we presented the information, it was for the entire health department, but Dr. Jackson wanted us to whittle it down to the nursing corps. And the total number of nursing positions that left since March of 2020 was right at about 40%. There was a total of 75 vacancies for all staff. Nursing was 30 individuals who have left since March of 2020. A lot of those departures were the results of a number of things, as you would imagine. We had quite a few resignations. We had quite a few promotions. We had quite a few retirements. COVID definitely brought out the vast array of options for individuals. Just like Duke and Lincoln Community Health Center and a lot of other places, we did bear the brunt of individuals who felt like, this COVID response, I'm not really in favor of it, or retirement is looking really good right now, and they decided to go on to greener pastures. But nevertheless, since March of 2020, the staff, and I continue to be very proud of them, out of 75, we only have 15 vacancies right now. So I am very grateful to county management, because throughout the entire pandemic, they did not hold out positions. We needed to fill it, and they were mission critical. They allowed us to fill it. And when they lift the hiring freeze, we were able to really go like gangbusters and get our positions filled. From an organization perspective, we have a very vibrant and active leadership team. And one of the first agenda items on our leadership team meeting is HR updates to include position tracking to see where we are to fill vacant positions. So again, we know that we still have a lot of work to do to fill vacancies, Dr. Jackson and others, but just wanted to bring this information to your attention.
Thank you, Rod. Dr. Jackson?
Yeah, thank you for that. And like you said, it is similar to what's been happening other places, particularly Duke and Lincoln, the two that I'm most familiar with. But what's amazing about that to me is that in spite of not having all those nurses there, that the mission never suffered, right? So everything still continued to get done with the staff that was there. And I'm sure you had to pull in some travelers or however to get it done, it got done. So glad to hear though that things are back on the upswing. So thank you for that. Yeah, nursing still remains a huge problem, I guess across the country, the nursing shortage. I mean, COVID may get better, but there's still going to be issues with the nursing shortage. So continue to do what you're doing and getting the job done. So thank you for that additional information.
Thank you, Dr. Jackson.
Thank you, Rod. Anyone else have any questions or concerns about the vacancy report? Hearing none, we'll move on to the NOV report. Any questions with regard to that?
Yeah, Eric.
Yes, sir.
This is Spence. As I look through that, the report alarms me because the first 3 violations are still ongoing, and they're 5.5 or 6 years old. And I really think we need to take some action that stops this. I mean, we're well beyond a time where we've been working with the people and trying to get a positive outcome. I don't think Attorney Wendell is on right now, unless he just came in.
Attorney Wardell is not on, Spence, but we're more than happy to take that information back. I will say, of course, 5 or 6 years ago predates me, but I know that the activity that I've been seeing as of lately between him and environmental health is one of aggression. He works extremely well and he's very responsive. So I would love to be able to research these first 3 to bring information back to you. And I'm pretty sure it's a complicated situation.
You know, and most of them, you know, the date on them is a 20 date, and they're working it, and I understand all that. But once it gets to be 5 or 6 years old, you're like, what's going on here? We've got effluent going on the ground for that long of a period. We've got to do something.
Gotcha.
Somebody's going to get sick.
We'll be more than happy to follow up with you.
Thank you.
Thank you, Spence. Thank you, Rod.
Mr. Jenkins or Eric, this is Chris. I know Brian's not
Chris.
here, but I can weigh in a little bit on this one. I can't say much about the first one on the list, but you notice there was a request for an attorney to file a lawsuit there. So that one I can't say a lot, but the other 2, if you notice, the violations actually no subsurface operator, and we've talked about this many times in the past, whether or not you actually want to go after somebody who there's not really an effluent problem per se, but you don't have an operator for the system that's required by the law. And some counties do and some counties don't, but we've kind of not ever really gotten a straight answer whether or not we want to do that.
Okay, let's focus on that first one, please, then.
Okay.
And Chris, if you would, let's see if we can get that that item you just mentioned on our agenda for the future, so we can have a real good discussion about it and see which way the board wants to go, instead of just leaving it kind of up in the air.
Okay.
Can we do that?
Yeah, we certainly can. And, you know, of course, the board members have changed, but we've discussed this in the past. But
Right.
yeah, that's I can see both sides of it. But yes,
Okay.
yes, sir, we can talk about it.
Very good, and that'll give us a chance to also bring some board members who are not that familiar with these situations up to speed.
Yes, sir.
Thank you. Anyone else on the NOV report? All right, hearing none, let's move to the health director's report. Any questions for Mr. Jenkins? Hearing none. All righty, we'll close out item 7 and move on to item 8. Any committee reports? All righty, hearing none, we'll close committee reports and move on to old business, with the first bullet being previously hospitalized due to COVID patients with adverse effects. I believe I asked Rod to look into this probably back in early spring, late winter.
Yes, sir.
Rod?
More than happy to provide some information. Special thanks to Deputy Liz Stevens for doing a little research on this. She is over our surveillance unit, and I personally think that she really enjoyed doing this research on this, which is all good. She did talk with Cam Wolf and a couple other people from Duke in her research, and she indicated that the Duke system is kind of not up to speed as far as their ability to follow previously hospitalized COVID patients with adverse effects. Patients do go to the specialty areas, mostly closely aligned to their complications, i.e. pulmonary, neuro, rheumatology, etc. So again, Duke recently submitted a grant to examine long-term complications, but specific plans have yet to be determined. I'm pretty sure that this is something that they're working on. However, UNC does have a multi-specialty clinic that is set up, and they call it their UNC COVID Recovery Clinic. and it's a lab that's it's a rehab lab. I'm sorry, it's led by rehab specialist Dr. John Barata, and they work closely in coordination with Duke. So, you know, that's an area where long haulers or people who have long-term adverse effects can go. Overall, our rates of long haulers, Board of Health, as indicated by, you know, significant health effects, is significantly different than the national rate, which is around 10 to 30%. And of course, that's due in part to all of our efforts around the vaccines. And it is our belief that our high rate of vaccinations are one of the reasons why, you know, vaccinations and post-infections, you know, have been able to mitigate the long-term effects. So again, our work is paying dividends on a number of different fronts. But that is basically all I had as far as the follow-up to previously hospitalized COVID patients.
Thank you for that. If you could you keep us apprised of the progress Duke makes with regard to the grant and the other work they're doing in this area?
I'd be more than happy to, sir.
Thank you. And you have anything for us relative to COVID variants?
Yes, sir. I have plenty. COVID variants, per the World Health Organization, sort of like the National Weather Service, they have begun to name the variants based upon the Greek letter system. With the exception of the National Weather System, you know, once they run out of names, established names, they go to the Greek letter system. But of course, the alpha is the B.1.1.7 or UK variant. That is now the more predominant variant in the state of North Carolina and the US. That is doubling every 10 days, roughly 50% more infectious and likely causes more severe illness. The beta, which is the B.1.351, is the South African variant, roughly 50% more infectious. Some vaccines are less effective against this variant, as you've heard within the news. The Gamma variant, as named by the World Health Organization, is the P1, which is the Brazilian variant. And then, of course, we have the Delta variant, which has been getting a lot of buzz lately. That's the B.1.617.2, and that is the India variant. And this is definitely on the rise in the state of North Carolina, but not at a point to where it's causing alarm. And the Epsilon variant is the B.1.427 and B.1.429, affectionately known as the California variants. They've been around for a while, particularly when California had like a huge outbreak that really was sustained infection period of about 2 to 3 months, roughly 20% more infections. That's the World Health Organization's take. Of course, the CDC has North Carolina stats that's updated every other day. As of 6/8, the Alpha variant or the UK variant was 68% infectious, which again is the dominant. The Gamma, which is the Brazilian variant, was at 2.9% in the state of North Carolina. The Beta, which is the South African variant, is 0.8% infectious, and the California variant is very low at 0.2%. As we all know, there are other variants of other lineages, right at about 28% that have not been named just yet. And last thing I will say is that in Durham, there's only been one dominant variant or one variant that has officially come to our attention, and that was our first case of the B.1.1.7, which is the UK variant, which was identified on February 23rd, 2021. And we did put forth a press release to that effect. We have not been alerted to any other variant officially by North Carolina Department of Health and Human Services. That concludes my report, Mr. Chair.
Thank you, sir. We appreciate that great information. And again, if you would keep us apprised of the any new developments or changes with regard to COVID.
Yes, sir.
As regard to the adjustment to the agenda, the third bullet under old business, a fee schedule update.
At this time, Mr. Chair, I turn it to Finance Administrator, Mr. Will Sutton, for some updates on the 2021-2022 fee schedule.
Thank you. Will?
Good afternoon, board. Promise I won't be with you too long. As you recall, in April, when I presented our FY22 budget, there were also a couple of fee changes that were noted at that time. But if you recall, there was an asterisk in one of the screens that indicated that there would be some additional changes that would be coming forth. Fortunately, with changing systems from Patagonia to Epic, and with the addition of new staff that's come on board, this is a great opportunity to look at our fees as a whole and determine or pinpoint some changes that need to be made as far as our fees. And let me share my screen here. Okay, can everyone see my screen?
I can.
Okay, great.
I'm good.
So on the first slide here, there are just seven new fees that are in addition to the ones that I presented in April. One is urinalysis test. One is hemoglobin. There are 2 HPV vaccines, and the last 3 are dealing with, telephone services. So just 7 new that would be added that have actual fees associated with it. Now on the next screen, these are ones that need to be added that do not have a particular fee associated with it. Their majority are for tracking purposes that we need in our system to make sure that we are being able to report on certain things. So of these 19 fees right here, they need to be added, but there are no charges associated with it. On the next screen, these 18 here are ones that have been identified that we can remove. They're no longer being used for the most part. And I guess historically they've been on a fee schedule. There's some that they're no longer being used, but there's now another fee that replaced the ones that are here. So that's why we have to remove these from the fee schedule and update it as a whole. Pretty straightforward. And on the next slide, there was just one where we were updating the description, just making a change in the description, no change to the fee itself. But last but not least, I want to touch base on environmental health in their endeavor to eliminate refunds of their application fees. Historically, it has been a little issue about the number of refunds that take place, after they've paid or for whatever reason going forward. And I've seen refunds that have taken place across fiscal years, so that they come in and apply for the refund. But our goal with this is to minimize the refunds and make sure that we're doing things that are in the best interest of Department of Public Health, as far as making sure that everything is making sure everything is accounted for. Now, I will say that Chris Salter, the Environmental Health Division Director, he did touch base with Attorney Wardell to make sure that there was no legal impediment to implementing a change such as this. And the only feedback from him was that to make sure that, one, we put an effective date in place far enough in the future where we are allowed or there's ample opportunity to get the word out and let everyone know that this change is coming forth. And so, as I discussed it with Chris, we decided that we can do January the 1st. So between now and January the 1st, the environmental health staff can endeavor to making sure they get this word out to all of their clients and all of the individuals that are coming in to apply for these services. And so that will become effective January 1. And it will also be posted publicly on the website, along with all of the fees, this little indication of this change. So pretty much that is, in a nutshell, all the changes that will require board action. I mean, there are others where, in going from one system to the other, we had to compare, what's in Epic versus what's on the fee schedule and make sure that they're in line. That would involve a change in the system itself with won't need any board action, but just these are the ones that will need some board action.
Thank you, Will. So you're looking for board approval for the fee schedule updates, correct?
Yes, sir.
Do I hear a motion to approve the fee schedule updates that we just heard?
Could I ask a question first?
Yes.
Mary Braithwaite. Will, on slide 3, I see that there were some no charge numbers there. I wonder about these codes like 99211, 212, 13, 1415. Those are for, looks like for visits that are billable. At least in private practice, we actually can bill for those visits.
Am I on the right slide?
Yes.
And which one are you asking about?
99211, 99212.
Well, in this instance, the ones that we're adding without the fee are in the CPC code. They refer to these CPC codes. They're also used in conjunction with the actual fees, the 992.
Oh, I see. Oh, I see. Okay, so you're still billing.
Yes, absolutely.
Okay. Thank you. That was my question.
Any other questions? Is there a motion to approve?
I move for approval of the fee schedule, updated fee schedule.
Second.
Curtis.
Very good. There's a motion to approve, and it has been seconded. Roll call vote, please.
Chairman Allen,
Yes.
Dr. Jackson,
Yes.
Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, Dr. Ray,
Yes.
and Dr. Miller.
Yes.
Thank you.
Thank you. Item 10. New business. Are there any items the board would like to see on the August agenda?
Hey, Eric.
Yes, ma'am.
It's me. So, I'm on vacation, so I'm thinking a little slow. I actually have a question back about the EPIC presentation, I guess for Marcia or Mr. Jenkins. I'm just curious as to why pharmacy couldn't be a part of EPIC for us.
Great question, Dr. Jackson. So one of the components that we are really trying to push for FY 21-22, well, let me take a step back. When Willow was on the table, UNC only had the offering for their in-clinic hospital services for the Willow, for the pharmacy. So they were just starting to implement the ambulatory side of Willow. And so during our implementation, they were just implementing Willow. And so we asked a number of times if, they have gotten to a point where they've streamlined that process and is ready to actually implement for their community connects. And so we're still waiting to hear back. But we are working towards that goal to implement Willow.
Oh,
yes.
Okay. All right. Great. Thank you.
Once UNC gives us that approval.
Okay.
Very good. There's an agenda item I'd like to see for our August meeting, and that's a quick discussion about moving back, the possibilities of moving back to a regular schedule, and that'll be dependent on a lot on the staff's workload, the department's workload. But let's be ready to have that conversation at our August meeting, if everybody's okay with that. And I guess that would also include whether or not it's the appropriate time to go back to face-to-face meetings, or based on what the county's current policy is with regard to those kind of meetings. Does that sound like a good topic for discussion for August?
Yes.
Very good. Anything else for the August meeting?
I was just wondering in this meeting, if we've heard any more about the governor's plan and the lottery and everything else for people who've been vaccinated.
Rod, can you help with that?
I can. I will say it is fresh. I too, along with you all, got wind of the governor's lottery at 3 o'clock today during his press conference. And we knew all about the gift cards, and I had been privately rallying for Durham to be included in the initial beta testing, if you will, but we can't get everything in Durham, I guess. But nevertheless, I'm just proud to say that Durham is, we're in a very good place, in terms of overall vaccination utilization and getting the vaccine out. We're second. I do believe that Wake, in terms of first dose and fully vaccination, they got us by a fair amount of percentage points. I am excited about this because I do feel like this is definitely going to get us over the hump, so to speak, to where we can really go toward the 60 to 70% inoculated. But nevertheless, more information to come. Spence. We just don't know all the details, but it can't be a bad thing. I have had some conversations prior to this Board of Health meeting with a couple of state officials that I know, and I'm just like, initially there was hesitation to do this, but it's my understanding that they saw the effectiveness of other states as far as spikes in vaccinations and everything, and they thought, hey, let's just give it a try. But nevertheless, we hope we have a lucky winner from Durham, but we're going to keep moving forward. Our right foot is not coming off the accelerator anytime soon.
Thank you, sir. Any other new business or agenda items for August? And Rod, if you or staff have anything you need to bring to us, please do so. Informal discussion, item number 11. Anything board members would like to discuss, talk about? Hearing none, the chair will entertain a motion to adjourn.
So moved.
Second.
It's been moved and properly seconded to adjourn. Roll call vote.
Is anybody gonna say no?
And she's in Florida.
That's why I'm in a hurry to get off. So I have the meeting right after this one.
We'll just say we can't wait to see you all in person.
How about that?
Here.
Very
That'd be
good.
great.
I've seen Dr. Jackson, Dr. Braithwaite. I've not seen the rest of them.
Oh, let's take a vote on the motion to adjourn.
Chairman Allen,
Yes.
Dr. Jackson,
Yes.
Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, Dr. Ray,
Yes.
and Dr. Miller.
Yes.
Thank you.
All righty. Thanks, everybody.
All right.
Very good meeting. Appreciate you.
Take care.
Yes.
Yeah.
Thanks,
y'all for
everybody.
everything.
Come September.
Appreciate y'all
Good
support.
job,
Right.
In
Eric.
August. I'm sorry.
All right.
Bye.
We'll see y'all.
Bye-bye. Take care, Rod.
All right now.